Florida Governor Rick Scott, who came to politics after a career in health care, and he was in meetings all day on Capitol Hill talking about this bill. Governor Scott, good to have you here. I mean, this is really the opposite of what you spent your life in the private sector doing, which was to give a lot more choice to people and to allow the free market to have a role in health care choice. And that a lot of Republicans say we are so far from that where this bill stands today. Do you agree with that?
Well, look, this is a work in progress. I appreciate the fact that President Trump and Vice President Pence, who I met with Vice President Pence today, they're working hard. They want to repeal and replace Obamacare. Let's look at the numbers. Obamacare is a disaster. Costs have spiraled out of control. We knew that was going to happen. The only way you're going to get costs down where people can afford their own health care is more competition, allow people to buy the insurance they want to buy.
I mean, you know, this is what Zeke Manuel and I were just talking about. You had millions of people who opted out of Obamacare. They said, I don't want to pay, either I'm going to pay the fine or I'm just not going to check the box and I'm going to ignore it. And in those cases, they weren't fined. But you either have to have it one way or the other in terms of how I look at this. You either have to have everybody buy in, essentially have a single payer system, or you have to allow the free market a larger role in health care in order to bring prices down. Is that right?
Right, Martha, the free market works. It works in every other
industry.
industry.
That's not what we're getting in this Republican bill, is it?
Well, I think, look, they're still working on it. You know, I came up fighting for Florida. I want to make sure that our state gets treated fairly by Medicaid reimbursement. We pay our taxes, just like every other state. Our taxes, our federal taxes, aren't any lower. So I want to make sure that the Medicaid reimbursement coming back to us is fair to us. And second, whether you have a pre-existing condition or not, you should be able to buy the insurance you want. You will spend your money smarter and better than anybody else will. I grew up in a family without health insurance. I know the struggles my parents had to get health care for a brother that had a significant hip disease. We've got to give them less expensive health care, great health care at a price that they can afford.
All right. You say you're there fighting for Medicaid reimbursement for your state. That's what a lot of governors are doing. Nobody wants to give anything back once their state has been given it. Now, I think it's a legitimate question to ask why we have such an increase in people on Medicaid. And the subset question there is, should able-bodied people have to work in order to get Medicaid? But you've got an economy that's generally improving over the last several years, and yet we have more and more people on Medicaid. Why is that?
Martha, we didn't do the expansion because we knew the federal government could not pay for it. But here's the numbers. We have 1 million more people on our basic Medicaid program than New York, and they get paid $23 billion out of the federal government, and we get $14 billion. How is that fair? I want to make sure we take care of our taxpayers. I want to make sure we take care of our citizens. I want people to get health care, but it's got to be fair to our state. We didn't do the expansion. So we need to get the same rate per person as every other state, and then give our citizens a choice of what to buy.
Governor Scott, thank you very much.
Thanks, Martha.
Best of luck to you in Florida and to the folks in Washington trying to hammer this out.